Hey, this is Dr. Drew, and you are listening to This Life
with Bob Forrest
and Dr. Drew. And we are joined this week by the ambassador to the BergaMet fruit, Dr. James Ehrlich. Dr. Ehrlich, why don't you describe your medical history and training?
Well, I'm a clinical associate professor in the Division of Endocrinology at the University of Colorado. And initially, I was an anesthesiologist, and most of my career in the last 20 years has been involved in tests and technologies in the early detection of cardiovascular disease.
Let's put that in sort of layman or simple language. You're interested in preventing vascular disease, which is like heart disease and strokes, these sorts of things, and the metabolic conditions that can accelerate that or cause that. Would that be about accurate?
Exactly. Okay. Yeah, that's very accurate. I like that.
Yeah. And in the course of this, you were in sort of a traditional medical research background, and you came across BergaMet. Tell me about that.
Well, a friend of mine who's a preventive cardiologist in Australia, and is kind of like the Dr. Oz of Australia. He's got his own successful radio show and a lot of books out, alerted me to a fruit that only grows in southern Italy that he now has 5,000 patients on, and he uses it to decrease cardiometabolic risk factors. So he told me about it. I then went over to Italy to investigate this. I became part of the efforts to research this, and now I'm the ambassador to Bergamoto. Since 2013, I'm the director of research in the United States for this particular fruit, and there's a big research laboratory in Calabria, Italy, at the University of Catanzaro.
I'm not a supplement guy. I have to be really persuaded, and you exposed me to some of the research that was coming out of that institute. And it was really quite striking on many fronts. I've been persuaded. What would you say the benefits are of taking BergaMet?
Well, I think the main benefit is lowering what we call cardiometabolic risk. In other words, about 35% of us are affected by metabolic syndrome, which is considered the epidemic of the 21st century.
I got it.
It's basically
I have it.
Yeah, you have a little bit of it. I think very little probably, but that's my guess.
Well, little in the sense that I work hard to push it back, but I've got it for sure.
Yeah, and many of us have it in the standard way. We don't get enough exercise, or we eat poorly, and so expanding waistlines, elevated cholesterol, hypertension, and other types of factors of insulin resistance combine to cause this syndrome, which is now becoming the way most people get heart attacks, strokes, and diabetes. So this particular fruit, the BergaMet fruit, our formulations are called BergaMet for the metabolic syndrome, which is this very dangerous condition that's extremely prevalent in the United States.
Now, in the past, you and I would probably treat that with exercise, diet, statins, cholesterol-lowering medications. Those are, by the way, all things I still do myself. But you're saying that BergaMet may delay the need for all that, or could be a good adjunct to that. Is that accurate?
Oh, I think it's an adjunct. I think proper lifestyle management is never substituted by either nutraceuticals, supplements, or drugs. I'm a strong believer in statins for people who can tolerate it, especially those who have plaque, which can be measured. And so I, for example, use BergaMet along with statins.
Yeah. You yourself? I mean, you prescribe it that way?
Well, that's the way I use it personally.
Yeah, me too. That's what I'm doing. That's actually what I'm doing.
But now I'm on twice a week statins, and then I take the BergaMet every day, and I get a nice complementary effect because BergaMet lowers blood sugar. Statins don't do that. In fact, statins are feared in a few people to raise blood sugar to the point of diabetes, and BergaMet raises HDL, the good cholesterol, much better than a statin. So I like the complementary effects, including lower of triglycerides quite substantially, and decreasing visceral abdominal fat, the dangerous abdominal fat that's a very active endocrine organ causing heart disease and stroke.
How does BergaMet do this? How does the polyphenol in the BergaMet fruit do this?
Yeah, well, the BergaMet fruit has a mixture of polyphenols. It's probably the most antioxidant polyphenol fruit on the planet. And some of these polyphenols are really HMG-CoA reductase inhibitors. That's a fancy word for statins. They're natural statins, but they don't have side effects. And some of them are called gut sterol inhibitors. They inhibit the absorption of cholesterol, like a drug called Zetia. And then a few of them are AMP kinase activators, like metformin, that both decrease visceral fat and drive blood sugar down. So these are just these complex mechanisms. We've got a lot of chapters in textbooks about all the mechanisms of action, but basically that's it. It really both improves cholesterol profiles and blood pressure and insulin resistance. Very importantly, uniformly, it improves the health of vessels. So even if you don't have risk factors, if you want healthier vessels, and we've proven this by looking at how compliant these vessels are, how loose they are. You don't want stiff vessels. And also what's called endothelial function, which is the health of the lining of all of your arteries. And these are proven. We've done extensive studies proving the value in vascular health.
The endothelium is the cells that line the inside of arteries. And when probably you were coming up and I was coming up, certainly it was it's an organ system, much like you said that gut fat is an organ system. This is an organ system.
Yeah,
too.
it's the largest organ in the body. It covers 6 tennis courts in surface area in the average 150-pound man. So it's a quite interesting tissue or organ.
And I don't think the average person thinks of it that way, but they need to. Bob wanted to ask a question.
Yeah, I'm just the token layman here between two doctors talking.
Yeah.
And a lot of my friends, like I'm sitting here, I have cold pressed juice, beet juice, and watermelon juice, and a lot of my friends that are coming up in their 50s, that generation, are very much not traditional medicine followers. And I think most of my friends are going too extreme left, if you want to go left-right about it, thinking that if you just take bergamot or you just drink beet juice or you just take turmeric, you're going to be okay. And I think this conversation you guys are having is where we need to move in the future, where medicine and healthy living and health and wellness work together and respect each other. And I see you guys doing that. For sure.
And before Dr. Ehrlich answers, let me put a little finer point on that, because it's complicated what you're saying in reality. Article in the New York Times this morning. The current stage of antibiotic use is going to end because the bacteria are going to figure out how to resist everything.
Yeah.
And they were saying in this article that this expert was saying that most of the new advances will probably come from old plant treatments that have been long forgotten. So we will pull these things forward, not using exactly the plant. And that is the other point I want to make, is I have terrible vascular disease in my family history. And you can only fight your genetics so much without pharmacology. Mm-hmm. And so you need to really talk to a physician about how to combine these.
And this is what's exciting. And we're talking to a physician who's going into that world with a medical mind,
for sure,
saying this is quantifiable. Yeah. I wish somebody would do that with turmeric, because turmeric is the biggest selling health food thing in the world. No science about it.
Well, maybe Dr. Ehrlich knows something. I mean? Hold on, let's ask that. That's a sort of a sidebar, but let's ask that question.
Yeah.
Go ahead.
Well, I think you're absolutely right that you need to combine a healthy lifestyle. I mean, we have to think of foods as either protecting your health, and some foods do that, or damaging you, certain fast foods and other things. And certainly we want to be loaded to the gills with the right combinations of healthy lifestyle and antioxidants and protective agents with this toxic environment that we have. So oxidative stress is a major cause of heart disease, diabetes, and other chronic disorders. Inflammation is a cousin of oxidative stress. And so it's very healthy to load yourself with fruits and vegetables that have a lot of antioxidants. And then we think this particular combination that's in and extracted from the bergamot fruit for BergaMet is super protective. And we're very excited by the literature that's been presented at the American College of Gastroenterology showing this unprecedented improvements in both liver structure and function.
Now you're talking to something I want to know about.
Well, it's for fatty liver, though, Bob. Hang on a second. Fatty liver is different from what you have. Bob has Hep C, and so he's... Can people with Hep C take BergaMet, or can people with chronic liver diseases other than fatty liver take it?
I don't think it's been shown. No, I don't. It hasn't been studied, put it that way.
But is there a downside to the BergaMet? Any risks?
No, I don't think so. It's not even metabolized by the liver, so we don't worry about patients with damaged livers handling BergaMet.
There you go.
So
okay,
good.
I'm going to take it.
You're in.
But but it certainly is something that very quickly improves cholesterol, blood sugar, blood pressure, abdominal fat, and inflammation.
And then you have different preparations. There's BergaMet Pro and then Mega Plus. How do we know which one to choose?
Well, I think we're moving towards most people will be on the BergaMet Pro Plus, and I think the Mega has been available on the internet. The Pro Plus has traditionally been available by physicians, but now we are making it available for your listeners as the Pro Plus, which is probably the top of the line, a little stronger.
I just have some out on my countertop in my bathroom because I've got to take it to some patients that want to do this, and I'm persuaded.
There are a few companies that are still selling their BergaMet products, but they're very low concentrations of the BergaMet polyphenols, and studies have shown that you got to have the highest concentrations to have the most people benefit by the most amount.
There you go. BergaMet Pro Plus. BergaMet is a sponsor of our podcast, Bob. And James Ehrlich is the brains behind this. And give me the title again here in the U.S.
I'm the ambassador to Bergamoto. When they told me I was going to be ambassador, I said, let me check, but I don't think I've ever been made an ambassador of a fruit before. So this is the first.
Congratulations, Mr. Ambassador.
Thank you.
Dr. James Ehrlich, thank you so much for calling in. We appreciate all the info.
Thank you.
We'll check in with you again.
Have a wonderful weekend.
You too. Take care.